With the Affordable Care Act becoming law in 2014, access to providers in a traditional model will become increasingly difficult and more expensive for most Americans. This will be exacerbated in part by a shortage of physicians. Well, the picture seems grim, but according to our guest, John Palumbo, CEO of MD Aligne, there are more effective and accessible options for healthcare consumers available. Welcome, John.
Thanks, Jackie. It's a pleasure to be here today.
Tell us more about the challenges in healthcare services that consumers will face in the coming years.
Well, there's been some dramatic changes since 2010 with the Affordable Care Act being passed. And really, some of the changes can be summed up in four simple words: access, cost, convenience, and choice. There's a looming physician shortage that many of the industry experts assume could be somewhere between 100 and 150,000 physician shortage in the next decade, and that makes getting appointments much more difficult. From a cost perspective, insurance premiums are expected to go up, some as high as 100%. We've seen in some early states. But at the end of the day, it is really all about the shift of some of that financial responsibility to the healthcare consumer, us. From a convenience perspective, there's many new models out there that the consumers are going to have to learn. Some are called the accountable care organizations, patient-centered medical home, market exchanges. What's this all mean? We all have to become even more informed than we are today. And choice is going to become a real challenge in the sense that with the employer mandate being delayed a year, none of us are really sure what the employers who are in that 30, 40, 50 employee range, they're called applicable large employers, what they're going to do with their insurance. So there's many unknowns, much to learn for all of us.
So what alternative does MD Aligne offer?
Well, that's a great question. We've really pioneered e-health services, and with a real mission and focus on providing safe, affordable, convenient access to caregivers utilizing remote-based technologies. And it's not just about utilizing the web or utilizing smartphones or the regular telephone. It's really also about being able to have our patient customers utilize and execute our services around the health commerce. So they're also able to pay for their lab services, their prescription medications, and their imaging services, which really gives them the ability to manage their health their way and maximize convenience.
So, John, what impact will the Affordable Care Act have on consumer access to health care?
Well, there's many, many good things and intentions about the Affordable Care Act, and it also have some heavy issues weighing it down. From the positive perspective, really knowing that everyone in the United States will have access to purchasing health care insurance, the elimination of pre-existing conditions is a real positive. And also equality of services, making it easier to buy theoretically through the market exchanges, but also knowing that you have equality from one insurance company to the other. All very, very good things. Some of the challenges obviously are around the funding. With 30 million plus Americans potentially being able to now enroll in insurance plans, much of that being funded by both the state and the federal government, there's a huge gap in that funding capability. So what we really think is going to happen is there will be a learning curve. Many physicians, because of the significant reimbursement cuts, are deciding whether they're going to stay in a particular plan or not. We're seeing many physicians leaving Medicare, believe it or not, because of the dramatic reimbursement cuts, all part of being able to afford the plan. So, again, it comes back to access, it comes back to choice, and ultimately for us, it comes back to how will I be able to get the right kind of care for my medical need.
So you focus on e-health and telehealth. How have those things changed over the years?
Well, it's changed dramatically. Basically 30 years ago, it started really in rural communities, many hospitals, if you will, trying to serve those rural patients. And how do we begin to use early stage technologies to provide certain care services, whether it be a chronic condition or whether it be a discharge? As technologies have exploded over those same 3 decades, and especially the last decade, you really have begun to see e-health and telehealth companies emerge so that now they become an alternative model of getting patients, doctors, pharmacists, radiologists, and nurses connected, and allows us to really do it the way we want to do it. maybe in some conditions we don't need to leave our home or our work. There's really an estimate about 60 or 70% of office visits today really could be unnecessary if you were connected technologically.
Tell us about MD Aligne's iPass program. What is that?
Well, that's really a perfect extension for us in our mission. We're all about providing safe, affordable, convenient access. What we've done now is leverage the e-health technologies that we've pioneered and developed over the years, combined it with traditional face-to-face medicine, and also leveraging our patient base so that we're able to negotiate great prices for services. And it's one of the first programs of its kind to offer direct access to a nurse without any membership fee, without any registration fee, and without any cost to the company who's sponsoring the organization, sponsoring the program.
So what are the benefits to the consumers who use the program?
Well, again, for many folks, it's immediate access to a caregiver, a clinician, a nurse, helping them decide what might be the appropriate type of encounter for their medical condition. Second, it's about convenience. So how can I get care for myself, my spouse, my family member without necessarily having to leave work, leave home? And you're also able to get those ancillary orders, the lab, the pharmacy, or the imaging study actually delivered through the program at tremendous savings, up to 55% off in some cases.
That would be amazing. Can you give us some examples of the types of savings one can expect from using the iPass program?
Sure. When you take a look at the traditional office visit today, combined, let's say, with a prescription that was ordered by the physician, you're probably looking at somewhere between $200 to $450, depending on the medication and what that physician might charge for an in-office visit. Again, assuming you're in a high deductible where you're paying for the first number of dollars, not necessarily a copay. In our program, our average encounter with a prescription ranges anywhere from around $105 to around $140. That doesn't take into account the lost time from work. Another example would be an MRI. Average MRIs around the country are anywhere from $1,800 to $2,200. Our contracted rates are in the area of around $750 to $850. Significant savings.
Amazing. So when should a consumer use telehealth services?
Well, that's a great question because there are limited conditions when you're utilizing remote-based care giving. It ranges anywhere from allergies to headaches to infections, colds, sinus, things like that. But really, it also can be utilized for second opinions. Geez, if you had an opinion and you don't want to spend another $100 for an office visit, you could use one of our physicians for a second opinion. It can be used for preventative care, so age-appropriate or gender-appropriate screenings. You could be traveling in the United States, not having access to your own primary care doctor, you could use the program. Or even one of your college students away from home. Gives them immediate access to somebody over the phone. But again, ultimately the physician decides what's the appropriate treatment.
So lastly, John, who can take advantage of these services of yours?
Well, because this is not an insurance plan, but it's open to anyone in the healthcare consumers in the United States, basically anybody that has some form of financial responsibility for their own health care. Those could be folks that are in high deductible plans. They could be underinsured. They could be between jobs and, quite candidly, not insured currently. And so as you look at it, we have 30% of our customers today who actually have medical coverage, but because of the convenience factor, choose to use our services, and then they can submit. So it's really open to anybody who has a medical need and wants immediate access to a caregiver.
Very interesting. I can see why somebody might want to just stay home if it wasn't anything too serious, or stay in their office and have a telehealth visit.
Sure.
Makes a lot of sense. Well, John, it sure appears that MD Align is poised to be a differentiator in the health services market. Thanks for telling us about this today.
Thanks for having us.
For 21st Century Health, I'm Jackie Bales. Thanks for watching.